we've got a panel today that we really think is going to be helpful to you. And in all honesty, it's helpful to me no matter how long I've taught here, because things have rearranged, reorganized. And so I'm enjoying every time I get to reconnect with these sort of reconfigured services on campus that help us and that help our students. So what we have today are three presenters who are covering areas that you have heard about, and you've seen them, you've heard just snippets of them, but this is our chance to hear from them directly today. And I think it's at a crucial point in the semester. I was thinking, out of the three presented, I have personally contacted two of these in the last couple of weeks with situations, and have been, I'm telling you, and I'm not just saying this because they're here, I have been so grateful. I've been singing their praises to people, and as a matter of fact, encouraged my department last Friday in the department meeting to do what I've just done, because it has been so helpful in guiding, and I've been here for a while, but there was one situation that was so helpful in guiding me through how to navigate that for the good of the faculty member, the student, and it's been so helpful. And then also referrals to the hub this year. That's just really a concept that we've not had, and it is paying off, and I've heard results from my faculty in the department. So that said, let's get started so we can give them each around 15 minutes and hopefully even time for you to have questions within that or at the end of it or something. Let's start with Erin Looney, who's the Director of Student Success and Retention, and that'll give us sort of an overview of the whole hub services and all of that. Then we'll move into David Quagliana. Dr. Quagliana is the Director of the Lee University Counseling Center. And then we'll move from him into Dr. LuAnn Bradford, who is the Director of Academic Support Services. So hopefully by the end we'll have a better view of how these things help us and our students. Okay, Erin, we'll start with you.
Sure, absolutely. All right, I'm passing along a couple things, and if you've heard me talk at any of the things that I've talked about this semester, because it's been a lot, that's okay. You don't have to take whatever, you already have one, but one of them is the Hub Quick Reference Guide. So kind of gives you a breakdown of all the offices at the Hub over in the Student Union, and some of the functions that we do, because I know it's hard to keep straight in your mind who does what, and so this has been helpful. And if you have one, you don't need to take it. The other is just a little card that we actually made for our open house that does this something similar. So it says on each floor where people are and what you might find there. So that might be helpful for students if they're unsure where we are. But I am Erin Looney, Director of Student Success and Retention. So this semester we launched the Hub. So all four offices moved over to the Student Union. My new team, the Success Team, First Year Programs, Academic Services, and the Center for Calling and Career. We're all up on the third floor together. And the Success Coaches, we have 3 full-time Success Coaches. They are in the, what they call it, the sub-hub, because it's down there by Subway. But the first floor of the Student Union, the sub-hub, yeah. Come by and visit them. They will love it. They're just real chatty, happy people, love to talk to you. And also down there with the coaches is this really cool collaborative space for students that's available. As long as the Student Union is open, it's available for students. So there's 4 big tables where students can sit around and work together with a screen on it, but it also has like a taller than me whiteboard next to it. So some of you in math and science who like to draw on boards a lot, it's a good resource for your students. So anyway, that's where we're at. And I've already probably communicated with a whole lot of you this semester. Your names are just ringing in my head. Students who you are concerned about. If they're missing your classes a lot, if they're failing your assignments, if you are trying to reach out to them and they're not responding to you, and you've emailed me or you've submitted self-service alerts for our new software, and we're trying to follow up with those students and connect them to resources to see if we can get them up on their feet and attending your classes and engaging with you and responding to you. So that's what you might contact me for in particular. And we'll have some more opportunities in the next couple weeks as we gear up for advanced class selection, where you're meeting with your advisees maybe for the first time. Do any of you have advisees this semester as new faculty? Yeah. I know sometimes they give you a semester to not do that, but some of you just jump right in. So, but we'll be having some training sessions to show you how to use that software. It's pretty intuitive. There's links in Portico, and Moodle already. So if you see this Faculty Hub link, that's what, if you open it up, you'll see all your class rosters, and you can click on a person you're concerned about. It'll give you a variety of options, like excessive absences. You can click on that, write a note to me, and we will get on it. So what's encouraging to me, and I think this is okay to share with you, so we've kind of tried to focus our efforts, our proactive efforts, on a group of students that we know are less likely to persist based on the data that our institutional research office has given us. And the students that are being referred to us so far are in that group. So we're trying to have those resources and be proactive with those resources, and it's kind of confirming that we know, right, that these are the students who are at risk, and we're trying to support them. So it's just all that to say that. The other person you might work a lot with in the hub, well, you work with all of us, but academic services assigns advisees. So if you have questions about that, you would contact them. And now that advanced class selection is coming up, then you might be hearing more from Crystal Randolph over there. And the Center for Calling and Career has been quite busy this year, now that they're over with us. But they're available for any kind of, lots of faculty invite them to their classes to talk about strengths, or lots of different things, careers in different areas. And their capstone classes, I know they come and speak. So anyway, that's kind of who we are and what we're trying to do. Does anybody have any questions? I'd be happy to answer any questions or concerns that have come up. You're just not sure where to refer students, or unclear about who does what. It's not a very good end of a sentence, but just throwing questions out there. Yeah.
How often do you want us to maybe notify those students? So there's been a couple cases where you have contacted me, but it was several weeks
Yes.
ago, and it's ongoing concern.
Yes.
Do you want us to resubmit that information, or is one time semester? How do you want that?
Yeah, so there have been, so when we get a concern like that, I will often, let's say one of you says the student has not been attending my class. They attended the first 2 weeks, then I haven't seen them for the last 2-3 weeks, and you tell me about that. And then what I will try to do is I'll contact their other professors and to see what's going on in their classes, to see if this is just your class or all classes, kind of a pattern. And we see what kind of approach we need to take with the student. But I think it will be helpful to find out if, we've tried to intervene with the student, maybe we've done something, or maybe we haven't been able to, and they've kind of fallen off our radar a little bit, or we talked to them and they're like, yeah, everything's fine, we, resolved this, or they were in the hospital or something like that, but you're noticing they're still not back. I'm more than happy to hear about that again, to see if we need to, do something else, right? Yeah. The other office we work a lot with is residential life and housing, because they're living with these students, right? If they're on campus, they're there, they have that relationship with them. And sometimes if they're not responding to me because they don't know me just sitting over there, maybe they'll respond to somebody they know and they trust. So we kind of really try to take a holistic approach and see if there's somebody that we can connect with that knows the student and the student trusts. And sometimes that works to move them forward, and sometimes, okay, well, they talk to them, but they're still not going to your class. We don't know what they're doing. They're not responding to anything. So, any other questions? Well, I appreciate so far all the communication you've had with me and being willing to reach out to me with these concerns. And, we're trying our best to connect with those students and make them, a bit more successful in your classes. And I know you're concerned about them too. So that has just been great for me to see how, engaged and concerned you are, caring about your students. So good job to all of you. But let me know if I can help in any way. And the things that are not at the hub would be the counseling center and the tutoring and academic support piece for students with disabilities. LuAnn will talk about that, but that's not in our office. Now, if you have concerns, kind of overarching concerns, we work closely with each other you know, to connect students to those resources if we feel like that's a good fit. So that's all I've got.
Hey, thank you, Erin.
Yeah.
I will say, just from having been here while Dave's coming, having been here a long time, you know, we have academic challenge, but most of the time, the reason students fail is because they just don't come to class. And it's not because it's above their head, they just don't come. And so that's why we're so grateful now to have a place that we can very quickly, without feeling guilty for just shoving work on somebody else or some other vice president's office, now just quickly refer somebody in and say, hey, we've got too many absences already. And it's wonderful. My faculty are really appreciating that. So, thank you.
Another comment is half of you guys haven't been here very long. We're really fortunate and lucky to have the Hub and the Student Success Center because of efforts by people like Carolyn Dirksen and a handful of others, I don't know, for about 10 years to really try to get the right grants and the right institutional support to create something like that. So it's really a privilege to have your group of departments existing and all located in the same place and collaborating and working together. So really good resource. Since Carolyn isn't here, I am going to introduce myself as she usually introduces me. She pokes fun at me a little bit, and I think I'll throw that out there. So this is David Quagliana. He is the director of the Counseling Center. And listen up, because this is one of the very few times that the Counseling Center will actually communicate information to you. Usually it's the other way around. You're telling us stuff and we say, well, I can neither confirm nor deny because of confidentiality. So that's what Carolyn usually introduces me. So the Counseling Center is... I'm going to kind of run through this PowerPoint. I brought 25 guessing. I don't know how many people are here.
Here's a couple more. I'm good.
So let's start with who is the Counseling Center. So I'm the director of the Counseling Center. I'm a licensed psychologist, and I'm also faculty. I'm an assistant professor in behavior and social sciences, mostly teach graduate counseling classes. The person you're most likely to interact with directly would be our senior secretary to the director, Lisa McCant. And we also have an assistant director, Brittany Gates, who's also a therapist, a licensed professional counselor there. And then our staff also consists of about 4 additional full-time therapists. Some are close to full-time, not quite. And then depending on the semester of the year, we have a certain number of interns who are master's level interns doing part-time work with us. Right now we have 4. Sometimes we have 6, sometimes we have 3. That kind of varies. So that's who the Counseling Center is. And what do we do? The primary thing that you guys think of is we do counseling at the Counseling Center. We do psychotherapy. It's different than pastoral counseling. It's different than career counseling, but mental health or psychotherapeutic counseling is primarily what students take advantage of. So individual therapy, couples therapy, I suppose we could do family therapy, but I don't think that's ever happened. We certainly have parents come in or call in. And then we have a really thriving group therapy program that's not just like a 12-step or support program, but a very intense interpersonal psychotherapy group program as well. We also think that it's really important for us to care about and engage the mental health needs of all the students, not just the approximately 10% of students who come to us in any given year. And so our outreach program is really important to us as well, where we get to see the students who, for one reason or the other, aren't going to walk through the doors of the Counseling Center building. And so there's all kinds of different outreach stuff we either do on our own or that we also do in collaboration with other departments and sectors and things like that. One of our main pushes with outreach over the last year or two has been on the topic of resilience, something that really does apply to all of us. It definitely applies to most of the students who are here. They could learn a little bit more about or grow a little bit more in their resilience, their ability to not just survive, but actually recover from and grow because of the various forms of adversity that they're dealing with. So that's one of our big pushes, but there are tons of other things that we do, outreach events or guest lecturing or something like that on. And this is an important piece to what we do, not just because 90% of the students aren't going to come to the counseling center this year, but because prevention is always easier and more effective than intervention. And so I like coming to talk with you guys here and now, hopefully before some or most of the student crisis situations come up. I love for you to know who we are and to get to know us and how to talk to students in a resilience building kind of way, rather than the first time you ever interact with anybody from the counseling center is when you've got that student that you know, oh, I got to talk to that counseling center guy because this is a problem. So prevention, early intervention, it's a big thing for us. So that's why we like talking to faculty now, not just in that email that you send me sometimes about students with suicidal thoughts or with eating disorders or depression, or just, I don't know what's wrong with them, but they're not showing up to class and there's problems here. So we're definitely open to that kind of contact as well, but I like to get out in front of it if we can. So students get psychotherapy from us. We do a lot of outreach programming. We have what we call walk-in times, and every day except for Wednesday, we've got 90 minutes set aside with a couple of staff members to just deal with whatever students come in for. Usually what that ends up being used for is an intake appointment. We do an intake, we gather information from them, and then once a week we all meet together to figure out what we call our disposition meeting. Okay, we had these 15 students come in, we have this many openings on our caseloads, who should work with whom, are they appropriate for interns or not, do we need to do additional assessment, refer them out for specialized services, those kinds of things. But we've got time set aside, it's on our website when we do those walk-in appointments. We are available if you've got to send a student over in crisis, especially if we're dealing with something related to harm to self or harm to others. You know, we'll find a way to make the time outside of those walk-in times if you're concerned about their safety, anywhere Monday through Friday during our normal business hours. We do offer medication because we have a contract with psychiatric providers in the community, but we only do medication for people who are receiving ongoing services at the counseling center. So if they are therapy clients, they can get meds with us and kind of talk with the therapist about that. We don't do medication-only services for any student on campus. There'd just be way too much demand for that. We also just don't have the ability to do psychological assessments and reports. So if a student thinks they have ADHD and they don't really want therapy, they just want to figure out whether they have ADHD or if they have a learning disorder or something like that. We're not able to do that. I'm the only person who's licensed to be able to do that kind of assessment. Master's level people can't do it, and there just isn't enough time in the day to be able to handle those kinds of things. So we do refer those out. So that's kind of what we do for students. When it comes to faculty resources, I think the primary thing is we don't just do therapy. Psychology is not just about therapy. It's not just about student concerns and crises. There's all kinds of other stuff we can do in addition to consulting with you on student concerns and crises. Course integration, guest lectures, helping out with clubs and teams and figuring out what psychological needs they might have. If you have personal and family psychological questions, we can't provide ongoing therapy for you, but we're always happy to have a member of our staff sit down, help you figure out what's going on, what resources you might need, and whether it's give a little bit of advice or kind of point you in the right direction for services. We're happy to do that. Lena Barber and I do that on a pretty regular basis with various faculty and staff members. And doing a needs assessment for your department, for your class, for some group of students that you're working with in a club. Like, what are their mental health needs, and how can you or campus or the counseling center better meet those mental health needs, either preventatively or reactively. And then we also engage in all kinds of other stuff, teaching classes and committee service and things like that. Some examples of our areas of expertise. I do a lecture just about every year in Lisa Stevenson's feminist theology class on eating disorders, and it's become popular enough. She now gives me 2 class periods, and we go really in depth on eating disorders, body image, worth and value in a feminist theology context. With resilience, we're kind of all over the place, talking to faculty about it, doing 5-week workshops for students, and talking to staff and others about that. You can think about maybe the counseling center can help with my students who are music students who are looking at anxiety about performance seminar or something along those lines, and can we proactively talk to them about it? Or when they have the panic attack on stage, maybe we're going to consult and kind of talk about that. But you know, anxiety, performance enhancement for athletics, music, PR, theater, those kinds of things. Healthy sexuality, LGBT, assault prevention, you can kind of see those plugging in just about anywhere, whether it's a religion class, a biology class, sociology class. I'm an expert on neuropsychological testing. We talk about suicidality and suicide prevention on campus a lot, emotion regulation, all kinds of other stuff. So kind of just get the schema that the counseling center is not just there to provide individual psychotherapy for the students. We really want to be out of our offices, on campus, proactively helping you engage your students in healthy psychological ways and informing them about the psychological aspects of who they are. Which moves on to the next slide. We don't just refer. There's all kinds of psychological stuff our students deal with: identity development, spiritual and holistic identity, social and relational skills, emotion regulation, how to learn from challenges and failure rather than see it as an existential crisis that absolutely destroys their world. Performance enhancement, teaching them how to be a little bit more self-reflective or critical analysis, self-discipline, behavior change. There's just all kinds of other stuff that is psychologically relevant that we'd love to engage with you guys or directly with your students on, to help you incorporate that stuff in your class, to talk to individual students or groups of students. So doing all those kinds of things in addition to the psychotherapy stuff that we actually provide in our office. Let me talk about, you didn't ask for it, but I'm going to give it to you anyways. Here are some ways that maybe you can be intentional about engaging in good psychological development modeling for your students. When it comes to resilience, and there's actually more of this on one side of the one-page paper. It says student psychological factor and then campus responses. Just suggestions for how to think in a psychological manner about the way you engage students in class or in clubs or something like that. If students need to be able to develop better resilience, maybe we can treat success differently. Maybe success isn't just about achievement, getting a perfect grade, something like that. Don't lower your expectations just because they're freaking out about it. We give them high expectations, but then don't stop there. What do we do with those high expectations? Are we educating them that a challenge could be a good thing, not just an existential crisis? Are we helping students know that achievement and failure do not define their worth, their value, their calling? Whether proactively as a group or whether just one particular student is at a time when they failed a test and so they're ready to drop out of school and go do something totally different because it sidetracked them. One of my other things I always throw out there is grace is not always defined as giving them another chance or giving them a pass. I think sometimes we think it's loving to just give them another chance when in fact that might be enabling them to not make the change that they need to make. And I will disclose to you that I learned that lesson the hard way and then the good way when I was in college. I was depressed for 2.5 years. And I had professor after professor give me a pass, give me an extension, not really do much about the withdrawal that I did, and I took the other class again. It was getting suspended from Wheaton College for chapel probation violation that finally helped me understand that I actually had depression. I needed to get into therapy, get on meds, get my stuff together, and I went back and I did really well after going back. But I graduated with a 2.84 GPA because of that, because you can't erase 2.5 years worth of depression flopping around. And so the dean of students who suspended me, knowing it wasn't really about chapel probation, he just knew I wasn't functioning very well, used that as an excuse. It was a valid excuse to get me out and say, get the care that you need, then you can come back. He set a boundary with me. He allowed me to have the consequence that I had earned, and that was the best love I could have possibly received from him. Way better than the professors who said, sure, you can have another week, sure, we can retake this class, those kinds of things. So sometimes saying no, setting boundaries, allowing consequences, creating consequences is the most loving thing we can do for our students. Not always, but let's be critical in discerning and analyzing those kinds of things. And then Vygotsky is a Russian psychologist, a developmental guy who talks about scaffolding. And I think scaffolding is something that's really important, especially for this generation of not so resilient students. We want to put enough structure and support and assistance around the students so that they can succeed, but not so much that they're not flexing their muscle and there's no risk of failure and there's no challenge. It's kind of like give a person a fish, feed them for a day, teach a person to fish, feed them for a lifetime, that kind of thing. So those are just some psychological concepts that we can apply to our attitude toward teaching, our specific approach to teaching, that kind of thing. If you are curious about, yeah, but see, I have this one student and I'm concerned because what do? The other side of the one-page handout is a little bit of do this, don't do that when trying to talk to a student that's concerning you. And how do we identify that there are concerns? The next slide talks about that. I'm not going to get into all of it, but you notice some sort of change or any one of these concerning things. If you do want to consult with the counseling center, shoot me an email, give us a call. If you want to refer a student over, I'd love to know that they're coming because you recommended it rather than them just show up for the intake. I have a referral form. I didn't bring it. I don't want to give it to you. It's kind of long. I'm still messing around with it, trying to figure out the easiest way to let you guys have a form that tells me why you're referring them over to us without asking for too much extra time from you. But if we can know that you're sending a student over, it makes a difference whether they came over on their own or because this professor told me to. Right? It kind of changes the context. And there's plenty of other people to refer to. You get some in the room here. You know, with Hub and Student Success, and then Academic Support, and LuAnn's going to be here. Health Clinic, Student Care Committee is another organization chaired by Mike Hayes, where if you got a concern about a student, you can let him know. A whole bunch of people that all work together to kind of play the role of a case manager. And then there's a bridge between student care and student success with a case manager that kind of plays a role in both. And then we are located at Watkins Building, near School of Religion, between School of Religion and Public Library, second and third floors. There's our phone number, there's our intake webpage, and I talked a lot. What questions or reactions do you guys have? Yes?
It's an odd question.
I love odd questions.
The design, I fully understand the design is for the health and success of students.
Mm-hmm.
What protection is available for us as professors? I understand HIPAA, I understand some of these things that are in play, confidentiality.
Mm-hmm.
But you all have information on students based on their scenarios that may have the possibility to create volatile situations
Right.
within the classroom.
Mm-hmm.
And so is there any dialogue there in terms of potential cases that may exist that professors could have an awareness?
Yes and no. Most of the time, we kind of try to farm out the ability to communicate. So there are a lot of times when we have sought a release of information between ourselves and one of the people presenting today or the Student Care Committee. And they need to know because they're a central hub of dealing with concerning students. They do not owe the same level of confidentiality that the Counseling Center does. So they are more likely to be able to give you either proactive or reactive information in the Counseling Center. There certainly are times when the Counseling Center is going to try to communicate. It's usually not proactive, it's usually kind of reactive. And we don't have to hold confidentiality when it comes to harm to self or others that's at that immediate and severe level. But usually we're not telling professors, we tell the person who it's going to take to keep them safe. So, and the reason for that, which sounds small but is really huge, is if the confidentiality isn't there, the extent to which it's not there, the vulnerability doesn't feel safe, and so there isn't nearly as much honesty. It is amazing, just amazing, the stuff that I know about these students and this campus that you guys don't know. And to some extent, it has to stay that way so that I can help them work on it and they don't get worried about what's going to be done with the information. So I know plenty of students who are violating the student covenant and that kind of thing. And sometimes it drives me nuts that I'm sitting on information that I would really like to protect people from or with, and I can't do anything about it. Most of the time, it benefits our ability to be effective in the counseling center. So, yes.
What is the fine line between coaching and counseling competitive athletes?
But I'm a psychologist, and so you ask a simple question, and I give a really complex answer that's more of a question than an answer. That's what we do. I think to some extent you do have to try to figure out on your own what's my level of competence to try to handle this type of situation, based on your personality, your amount of time available, that kind of thing. I'll say therapy is not advice giving, and if all it took was identifying the problem and the solution and even the path for how to get there and handing it to a client like a physician giving a diagnosis and a prescription, I would never need more than 3 sessions with a client. I, as the director, average about 2 years with my clients. After we're done here, I got 3 clients in private practice who I've been working with on average for about 6 years. There's this relational process that has to be present, this emotional relational process for change to happen, not just insight. And so, to some extent, the answer is, what are you going to invest? How consistently and safely and competently can you invest in the change that student needs? There's plenty of coaching and mentoring that we can do that doesn't explore at that same level of depth and journey with them. Was that a Freudian slip? Depth. I don't really have a black and white answer for where the line is between counseling and coaching. But yeah, I don't know, fear and trembling. And millstone around your neck if you lead people astray. Yeah, I think it's hard, but going beyond advice giving, and the more you get into the very detailed, vulnerable, ongoing relationship, the closer you are to being a counseling relationship. Yeah.
Kind of the opposite of the first question, what is our role in confidentiality? So if one of our students comes to us with a problem and they say, now this is just between us, right? Well, I don't want to violate a confidence, but at what point do I need to say something, and to whom would I say it?
My safe answer on that, and I'm not really passing the buck, is talk to deans and chairs in your department.
Okay.
And not everybody does the exact same thing, but for the most part, they all have a pretty similar threshold where if you get to this level and you're hearing about these things, at least the dean and chair want to know, and they want to be able to consult and decide whether something further gets done. In a more kind of therapeutic way, if a student comes to you and starts with, I want you to keep this private or confidential, don't agree. Say, I think it really depends on what you're going to tell me and what I think is most useful and necessary for you and for your benefit. I certainly honor and respect the fact that you want to be able to be honest and vulnerable with me, but I can't commit to that. I'd put it off the second they mention it. And of course, usually they try to rope you in to tell you all the stuff first and then. But the second they say, and you can't tell anybody else about this, I would immediately say, I'm not so sure that I can commit to that. I will say I understand the sensitivity, but I will also say I'm going to try to discern what you actually need. And if it's privacy, if it's confidentiality, that's what I'll do. So, yeah, they can be tricky like that, sometimes intentionally, sometimes unintentionally. I would avoid that piece. Because FERPA doesn't really apply here. It's not really related to that. And you guys aren't required in the same way we are, because it's not by the institution, it's by my license to keep things confidential. So I'd be quick to tell them how much you can or can't. And let me reciprocate on that with you guys. When you communicate with me, I do not owe you confidentiality. I owe confidentiality to someone who's signed an informed consent with me to engage in therapy. I will absolutely try to be wise and minimal and private with the information that I receive from faculty and staff, but I don't know you guys' confidentiality, and I usually can't promise it. So that's worth throwing out there too.
And we are required to communicate certain things.
Yes.
David, what's the process if we have a student that we are concerned about because of suicidal thoughts? Do we email you? Do we email Mike? What's the?
We should have a better one. That's my answer. I can give you some suggestions, but I wish we had a campus-wide do this, don't do that. So number one, I would strongly recommend you sit down and you talk with them about it. Be intentional about how you do it. I would do it in person. I wouldn't do it over the phone, text, social media, email, that kind of thing, because you can't really read the dialogue in the same way you can face-to-face. I wouldn't necessarily do it after class unless everybody else is cleared out and there's some privacy, that kind of thing. I have always told people, all the research bears out, you are not increasing somebody's likelihood of being suicidal or attempting suicide by asking. Recently, I have felt a need to add a second component to that, though. The second component being, there are things that will increase somebody's likelihood to engage in suicidal behavior. Unfortunately, Netflix is demonstrating that very well for us. Suicide sometimes comes in threes, and the reason for that is people who might just be thinking about it, but they don't have a sense that it could really be a real option. When they see that someone else they actually know has actually attempted or actually committed suicide, it makes it more real and does increase the likelihood that somebody moves from thought toward action. And so I say that not because I think you guys are likely to have some sort of conversation or behavior toward them that's going to increase their suicidality. It's exactly the opposite. But there are things in our culture, including 13 Reasons Why, and there's been some really good research on it, that's increasing suicidality. And I have all kinds of stats on university counseling centers all around the country for the last 8 or 9 years, seeing a significant increase in serious suicidal thought. Up until last year, there was not a significant increase in attempts and completions. I don't think that's true anymore. Based on what I've been seeing for the last month or two at the counseling center, it's kind of out of control. The amount of hospitalization we've been doing, serious suicidal attempts and things like that. I think between 13 Reasons Why and a couple of other factors, a lot of people are crossing that threshold. Have a conversation with them. Don't be afraid to ask, have you been having thoughts about death or about suicide? Then it's that question of what do I feel comfortable with going anywhere beyond that. There's certainly questions you probably can ask. How long has it been going on? How serious is it? How long do you think about it? Is it just a fleeting thought or does it stick with you? There's all kinds of other questions we ask about plan and means and intent and stuff like that. There have been those who have come on campus and done some kind of lay training, non-professional training for how to ask and persuade them to seek help and things like that. I think we need to do it again. I think we need a better streamlined break glass and read this if you are dealing with student suicidal thought. I'm hoping to design that sooner rather than later. I want to get into Res Life and get them trained up really well on this first because they're usually a gatekeeper that hears about it. I'd love to talk to other staff and faculty about it too.
Yes, sir. That was my kind of question. So we're not a required to report institution? I mean, if they come to us, I mean, I've worked for other organizations where if that's the conversation, we're required to report.
I think your deans will say yes. You are required by institutional policy to report it up the chain within your department. You're not required to report to the counseling center or some sort of threat assessment team or anything like that. And you're not required to report by the state. The only thing you're required to report by the state is mandated reporting of suspected child abuse that is currently occurring. Anybody who's a resident of the state of Tennessee is a mandated reporter with childhood abuse.
So if I've referred somebody over to you and I've done this a couple times and I guess it's not that they're suicidal or anything, it's just life is happening, they're falling apart. And so I say, well, why don't you go and talk and maybe they can figure out where to get you in to help you best. And all of them have come back to me and said, last semester, this semester, well, they said there's about a 6-week wait before anybody can get me in. Okay, because I mean, I've had this so many times, and so then I'm thinking, okay, well, there's got to be somewhere else I can send them, but I don't know what to do at that point.
They're exaggerating,
Okay.
or just flat out lying. And that's the trick where a release of information is helpful, because I can't tell you whether they came for intake or not, whether they never set foot in our office, or whether they came, yeah, we said we had our Wednesday meeting and we don't have any openings, here are some options for you.
Maybe
But we don't
that's-
just put anybody on the wait list, and we haven't had a 6-week wait for anybody in 2 years.
Okay.
Last year was a really good year, partially because the year before was a really bad year, and we had 55 people on the wait list at one time because the intakes were just through the roof, and Dr. Khan saw that, and students were complaining, and we were like, thank goodness, and we got another staff member. So we got another staff member, and we had 6 interns, and we basically had no wait list all last year. But this year, we've had more intakes in the first 3 weeks, and I haven't done the stats on 4 and 5 weeks, than we've ever had in a semester. Many of them have been really severe with suicidality, complex trauma, that kind of thing. And we went from senior staff having 75% of their caseload open to senior staff totally full in 3 weeks. And so we referred really hard into our group therapy program for those for whom it was appropriate. We always give them the option at the beginning of the semester. Wait for individual therapy at the counseling center if there's a wait list. Group therapy, and let's look at the times, and when we do a separate group screening to see if it's really a good fit and they're interested in going, or a referral into the community. So no one ever gets told, sorry, we're turning you away. No one ever gets told, you're just on a wait list. In the first 3 or 4 weeks of the semester, they always have wait list, referral out, or group therapy. The group therapy option goes away after the 3rd or 4th week of the semester. Groups have to close so they can do their work. We are currently running a wait list. We got about 18 students on the wait list. Only 1 or 2 of them are at like that severe level where there's really severe depression or anxiety or PTSD or trauma, or some level of suicidality that's not just passive thoughts but some active stuff. And no one so far this semester has been on the wait list for longer than a week and a half or 2 weeks. With the exception of 1 or 2 people who dropped the ball and they didn't call us back and that kind of thing. It's an unfortunate reality that for the last 8 years, severity and number of students coming to a counseling center have been increasing drastically. And because the severity is increasing, it also means it takes more sessions for them to make any progress. And so, unfortunately, there's not a lot of good options that we know well in the community for referral. The MFT clinic, which is literally right down that hall, is run by the Behavior and Social Science graduate programs for MFT. And they actually had a 1-month wait list at the beginning of the semester. They've kind of cleared that out, and so we can refer to them, but if we refer too many, they're going to have a wait list too. And then there's one practice in town with 4 or 5 providers that we really trust, we know really well. They're pretty much almost kind of sort of full. So then we run into, do we refer to somebody that we're not so sure about in town? Do we try to refer to Chattanooga? Do the students have money, insurance? Do they want their parents to know because they're going to see through the insurance? Do they have a car? Do they have an hour to drive down there and back and all that kind of stuff? And we're not comfortable at all right now. Like, we're anxious about it. You should see us during our disposition meeting. We've got this list up there, and we're like, what do we do? If I take too many clients on, I'm not any good to any of them. And if I don't take them on, then this person's going to be waiting. And it's rough. But that's a really long answer to that student who said they were told they had a 6-week wait. They're not telling the truth or not hearing the truth accurately.
Yeah, I would say that probably.
Yeah.
Can I speak back to the suicidal
Sure.
student? There are resources. There's the 1-800-SUICIDE hotline. But also, and I don't know if you could possibly provide maybe in somewhere in our documents accessible in Portico, but a new no suicide contract where they're sitting there and they basically are committing to you that they will not do anything to harm themselves. And if I feel this way, here is a phone number to call, that kind of thing.
I have to think about it, and let me explain why.
Sure.
There's some aspects of that you guys probably don't want to touch with a 10-foot pole. And what I do is we have what we call a safety plan that we use at the counseling center, which is different than a safety contract, because on a contract it says I am committing not to blah, and they sign on it, and it is absolutely no legal protection for you whatsoever and does not decrease the likelihood of attempting suicide based on all the research.
So
But we do have a safety plan form that is very similar to what you're talking about. Places and people I can be with, talk to, you know, these are the things I'm going to avoid, these are the resources that I have. And then on our form, it actually has 800 suicide, has the crisis response team number, has campus safety, this is when my next appointment is on our form, that kind of thing. Doing that kind of planning of what are the things you can do to keep yourself safe. Or we sometimes talk to them about, okay, you've been thinking about suicide for a month and a half. What has kept you from doing it? But again, we're getting into that level of, do you feel confident and comfortable actually doing that level of safety and opening that kind of stuff up with them or not? So it's tricky, but yeah, our portico is awful.
It is.
It's terrible, and it's
I just
on.
wanted, yeah,
It's on the
if we
list.
can
I
spread the
have
word, though,
more
then-
resources than you can possibly imagine on my T drive. I just got to figure out how to organize them and dump a ton of them out on Portico for you guys and students and staff.
I think she had a question several times, Dave.
Yeah.
Oh, I guess just my concern that, you know, number one, if there's no plan on how to have a conversation or the staff or any place to refer them,
Mhm.
there's no, university-wide plan, that really minimizes the likelihood that regular staff or any staff, faculty is going to even want to have the conversation if you don't feel confident that there's a way, you know, 'cause you're saying, don't cross this line, however, you really don't have a plan in place. And it's going to happen.
Yeah,
I mean, I know
absolutely.
that. So,
The more concrete answer is talk to deans and chairs immediately when you hear about it. You can always refer them to student care committee by contacting Mike Hayes in his office. And if there's a level of safety concern that has urgency, they'll contact Res Life or whoever immediately and try to get a hold of them. And you can always send them to the counseling center. The issue with sending them to the counseling center, if you don't walk them over and handhold, you don't know if they got there. And we are required to inform the right person to keep them safe, but not to inform the person who referred them over. If we know that you referred them over, and we ask them for a release of information so we can ease your mind that they got here, yeah, then we can do that. But if they don't grant that, then we can't.
I've already walked 2 students over, but it was over lunchtime.
Mm-hmm.
So.
Yeah, yeah. So 8 to 12, 1 to 5. And the reason why we don't have after hours is a handful of reasons, but one of them is psychologists and LPCs aren't really able to do hospitalizations in this state anyways. Crisis response team will come visit you wherever you are located, and they do assessments, and they can certify somebody or pre-certify somebody for the hospital. They can do involuntary hospitalizations if they have to, and they can run insurance and that kind of thing. So there is a free service that will come to your location that's designed for that by the state, and on the flip side of that, we're kind of restricted from doing it. Basically, you bring them over to us, and we're calling CRT and watching CRT do their job for 2 hours with somebody that we don't know as opposed to somebody that you do know. So that's at least part of the reason why we don't do after hours work. Yeah, we've talked about counseling center for quite a while. I want to go back to one piece though. I want you to hold intention. I don't know what slide it's on. Counseling center isn't just about crises and concerns. I get it. They're really serious. Have some level of care, confidence, concern, consulting with us, consulting with deans and chairs, that kind of thing. We want to be a resource to you when you've got psychological concerns about your students. Absolutely. But think about the counseling center and think about the psychological issues in your students' lives beyond, I hope they don't kill themselves, beyond they're flopping out of school and out of my class. But what are the psychological factors in your students' lives for those who aren't in crisis that if you intentionally engage that, your students are more likely to succeed and be mature and holistic in their development, that kind of thing. So counseling center tries not to just be emergency psychological response to the campus. Trying to be more than that. All right, so that's counseling center. Should we fake it for Dr. Bradford?
Well, we could either do that, or, or Carol maybe schedule, I don't know. Yeah, you wanna make a statement, you wanna say what you know about what she does?
Sure.
Well, seriously, I mean, because but I think to kind of differentiate who's what and who you do refer to.
So the short version for Dr. Bradford's office, they do two main things: tutoring and disability accommodation related services. When she talks about the disability accommodation stuff, usually what she says, so kindergarten through 12, it's the school's responsibility to assess and figure out whether there's a disability and then put an IEP in place. When students get to college, when they get over 18, when they get out of high school, it's not our job anymore. So it becomes the student's job to come to Dr. Bradford's office to say, I have a disability, need accommodations, and here's the professional who wrote a report that proves it. And then she's the one who creates the document that says, we've verified that there is a disability here, and these are the accommodations that are going to be associated with it that impact you and your class. If the student doesn't come ask for that, they don't get accommodations. If the student brings it to you the week before final exams, those accommodations apply during final exams, and they do not apply to anything that happened retroactively. So it's the student's responsibility to get that form from her office and to bring it to you. And she usually goes on quite a while about like trying to get the students to not say, yeah, I got a disability, I got one.
Yeah.
But to find a time to sit down and talk with you about it. Because there's certain disabilities, okay, great, thanks for letting me know. There are others that are going to take some effort on your part to protect their privacy, but at the same time seek out a new note taker for class or something along those lines. You are not allowed by ADA to ask what the disability is. The form says, student has a disability, we've verified it, and here are the accommodations. You're not allowed to ask them what the disability is. There's a good number of students that are going to proactively tell you anyways, but we can't legally ask what they are. Very often, you're getting something like double time, even more common, 1.5 time on tests. She does quite a bit of conversation around, are you going to create the accommodations in your environment for extra time or a quiet testing environment or something like that? Or are you going to refer them over to her office to actually take the test or something like that? I don't want to go into all the details on the various accommodations and how to manage those because it ain't my job. I want to make sure she tells you and tells you how she would want to communicate it. You want to add anything?
Just the tutoring piece.
Yeah.
It is peer tutoring, and 100 through 300 level classes, generally they can find a student who has successfully completed that class and recommended by the faculty member to tutor the student. So that's kind of how that works. You need to send the student to their office and they fill out a request form, and then they seek out the tutor and the student connects with them. So
that's something you will get a request from her every once in a while, is to identify students that you feel would be really good in your particular area to tutor the students. We've gotten that.
And usually when it's finding a note taker in class, it doesn't really go through her office. You're the one as the faculty member to say, there is a student in this class who is going to need a note taker. If you're interested in volunteering to do that, come talk to me after class and we kind of connect them.
Can I add one tiny little thing to that, to what she was saying about identifying some students in your class who can help with tutoring? Even if she doesn't ask you, I've learned this because there are often multiple sections, different instructor, you may have a different idea based on your own vocabulary, who you want to identify. That's really helpful for her to say, these are the 3 people I would rather have my students tutor with.
That office has also been helpful in helping us set up group tutoring sessions for like Spanish tutoring labs and those kinds of things. We run through that office, and it's been enormously helpful. So I would say if you have ideas for tutoring for individual students or for group tutoring, just talk to that office about it.
Can I add something that might be helpful? I've referred, I think, 3 or 4 students to her this semester because I had students who came to me and self-reported to me, I have this illness and so I have to be gone for doctor's appointments on these days, or I have this illness and so sometimes I find it hard getting to class. And I've said, go report it to them. And what that allows me to do for my attendance policy is not just say, okay, I'm going to excuse that student, but I'm going to make all the other students be there. I think every student I've sent to them has been registered with them, and then I get a note saying, yes, this person has this illness. So then I can say, oh, they were absent and I'm not gonna count that absence because I know they are struggling with this and it's recognized by Lee. So it's given me lots of freedom to give grace and help to them and protected me from other students saying, well, that's not fair. So.
I'll throw something out there on a particular accommodation that there's a lot of debate and discussion about. Emotional support animals and or service animals. First of all, they're not the same thing. You guys should never have to deal with a situation with an emotional support animal because they're basically not allowed out of the dorms. They can have them in the dorm and maybe right next to the dorm to go to the bathroom or something like that. Not allowed to bring an emotional support animal to class and around campus, that kind of thing. A service animal, the level of threshold for needing one is higher. The specifications on the training of the animal are very, very much easier to clarify and understand, and they are allowed to bring those animals into class. If there's disruptions, or if you've got questions around animals and stuff like that, contact Dr. Bradford. She's happy to talk to you guys about it. She knows all the ins and outs. And connecting it back to the counseling center, there are occasions when we are willing, if we deem it necessary, to write a letter for a student that is our professional saying, yes, it would be advantageous. We're supporting the idea of them having a service animal. The counseling center will never, ever write a letter for an emotional support animal. We don't think there's good enough research on the effectiveness, the unique need for it, and there's not nearly good enough structure around what kind of animal and what kind of training qualifies that animal. So there aren't good enough criteria for us to figure out whether a student needs one, so we have a policy. We don't write those letters. Now I say that, but I actually contacted LuAnn today about maybe doing it with one student. But we don't never write letters for emotional support animals.
LuAnn's office can also essentially proctor exams. If you've got students that are going to be out of town for lead singers or something like that, and you want a kind of safe environment for them to take the exam, or if you have students where English is not their first language and you want them to maybe have additional time, that would also be something, but they have certain times that you have to schedule.
And her secretary is Tanya Cook. Tanya's been there a long time. She knows everything that you might need to know, so don't be afraid to call over there.
Well, the bottom line of it all is just ask questions. If they don't know how to help us, they'll tell us who to go to that does. And thank you, Erin and David. Boy, David did a great job of covering kind of for LuAnn there as well to get it out. Thanks to all of you. Hope you have a great break. Again, thanks for visiting.